Namaskara, I am Dr. Rajendran. I am Senior Consultant Physician with over 25 years of experience. I am a graduate of Armed Forces Medical College. I was in the Air Force for 25 years and now I am doing practice here in Rajarajeshwari, Nagar. I practice at Rashtrotthana JAYADEV Memorial Rashtrotthana Hospital. This is a new hospital which has been started in Rajarajeshwari, Nagar. This is a very good hospital. It has got all state-of-the-art facilities, including ICU, echocardiography, dialysis, very good ICU facilities, and excellent nursing care. Today, we will be talking about infections in the coming few months. So, in the coming few months, the main infections that we will be encountering will be, number one, will be the respiratory tract infections. Most of these respiratory tract infections are viral in origin. What are the symptoms? They usually present with cough, nasal discharge, nasal block, sore throat, cough, and sometimes fever. So, the important thing is that at this point of time, you should always consult a doctor to make sure that you do not have any serious consequences of these infections. Most of these viral infections resolve by themselves and only need symptomatic care. There is no need for any antibiotics because these are viral infections and antibiotics do not have any antiviral action. The other set of infections which can occur in this coming months are the bacterial infections, including streptococcus, pneumococcus. They, however, require antibiotics. Sometimes they may lead on to pneumonia with all its attendant complications. So, in case you get fever with chills and rigors, cough with purulent sputum in the form of yellowish sputum or greenish sputum, immediately report to your doctor. Now, this is also the phase in which elderly people and immunocompromised patients are susceptible to a large number of infections. They should be vaccinated with both influenza and anti-pneumococcal vaccinations. The second group of infections which may be seen in the coming few months will be the gastroenteritis group of infections. Commonly they present as diarrhea, sometimes they present with vomiting. Now, where do these infections originate from? They are mostly fecal-oral spread in origin, which means that they spread from contaminated water. So, to protect yourself from infection, you should drink clean water, which means that whenever you go out in the coming few months, you should avoid eating street side food. And if you are eating street side food, make sure you consume hot, freshly prepared foods. And you should take only from those stalls which have got a clean water supply. Now, if it is better that if you carry your own water with you, and if the water is not available, you order a bottle of bottled water and drink it on the spot. The third group of infections will be dengue. Dengue is likely to come again in the next few months again as the temperature decreases. Now, dengue is a mosquito-borne spread infection. Remember, dengue is spread by Aedes mosquito. And where do these Aedes mosquitoes breed? They breed in and around your household only, in the form of water hole or in the form of small water collections, especially among the potted waters, especially among the cat food or some other plates which are lying around your water. So, clean your surroundings, make sure that these water collections are drained and are cleaned. And whenever, if God forbid, you do get dengue infections, remember, people have more serious complications if they become dehydrated. And platelet deficiency is not a very serious complication of dengue. The more serious complication is fluid loss and dehydration. So, in case you get dengue, you should immediately report to your doctor. If the platelet count is above 50,000, in all likelihood, he will not admit you and he will advise you to take treatment at home. In that case, you have plenty of oral fluids and make sure you keep yourself hydrated. If the platelet count goes below 50,000, you should immediately report to the hospital, wherein you will be given fluids and you will be given a lot of blood transfusions if required. Now remember, in dengue there is no use, these are all myths, there is no use of eating papaya leaves, there is no use There is no special benefit of eating papaya or kiwi fruits, although these fruits are good for your health, but they do not have any specific benefit in dengue. So please take care. Bye.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.